You're listening to the Pace Radio Network here at paceradio.net.
The views expressed by the individuals during this broadcast are their own opinions, and they may not be the same as those of their group or other organizations they may be involved with.
All medical advice during our broadcast is not a medical opinion and should be checked with your medical physician.
Oh yeah, baby, lovely.
Good morning and welcome to Psychedelics and Cannabis Educational News for December the 11th. And as we're in Canada and it is winter time, it is cold and snowy out there today. So make sure you bundle up warm wherever you may be. Now, before I get started, don't forget that if you like what you're hearing or seeing today, to hit your subscribe button or the like button, whatever you may have in front of you. You'll notice that Cindy has the day off today, and so I'll go along. I got 5 stories. They include, older people benefit from cannabis, opiate prescription reductions we're going to be talking about. Germany is saving billions because of cannabis. But I'm going to get the day going by talking about cannabis research studies, which is something that we're always told we need more of. Headline comes to me today from Leafly. Headline says, number of published cannabis studies grows for the 5th consecutive year. Yeah. There's studies out there, people. They just keep saying we need more. Now, for the 5th consecutive year, researchers worldwide have published over 4,000 scientific papers on cannabis, bringing the total number of published studies to more than 53,000. Now, according to the analysis, this is by the nonprofit advocacy group NORML. Now, the figures compiled through a keyword search of the National Library of Medicine's, their PubMed.gov database. It reveals that 37,000 peer-reviewed papers are on cannabis. Its components and their mechanisms have been published since the beginning of 2015. Now, the available catalog of research dates back to 1840, when William Brooke O'Shaughnessy published the first known paper on cannabis. It was titled "On the Preparations of the Indian Hemp, Their Efforts on the Animal System in Health and the Utility in the Treatment of Tinnitus and Other Convulsive Diseases." Dr. O'Shaughnessy discovered how cannabis can help settle the seizures in children. If you take a look at, look them up, you'll see that for yourself. Or you can go to paceonline.ca, click on the research button, and you will find a report there on Dr. O'Shaughnessy and the work that he was doing. Now, it goes on to say that despite the perception that cannabis has yet to be subject to adequate scientific scrutiny, scientists' interest in studying cannabis has increased a lot in the past decade, as has our understanding of the plant, its active constituents, their mechanisms of action, and their efforts on both the users and upon society, says NORML Deputy Director Paul Armanetto. It goes on to say it's time for politicians and others to stop assessing cannabis through the lens of what we don't know, instead start engaging in evidence-based discussions about cannabis and cannabis reform policies that are indicative of what we do know. Exactly. There's lots of studies out there, just named off the numbers, and you always need more, but just don't always have that as the fallback position. Okay, from there, we're going to move on to my next story. And this one, it's about older people and the benefits that you can find on cannabis. And here we go. Right there. This one comes to me from the International Cannabis Business Conference. Headline there says older populations benefit from medical cannabis. Exactly. Older generations were unfortunate victims of a significant amount of cannabis prohibition propaganda. It is no coincidence that in an essential every cannabis reform poll, older poll participants consistently demonstrate that the lowest level of support. The sad irony is that arguably the biggest potential beneficiaries of medical cannabis reform are the older population. It is no secret that as the human population ages, various ailments, health conditions, aches, and pains begin to accumulate. Medical cannabis therapies can help effectively treat many conditions that older individuals experience. A team of researchers affiliated with various academic and health research institutions in Canada conducted a survey asking older adults about cannabis use and how it affects anxiety, insomnia, and depression. They said that a total of 1,615 older Canadians completed the survey, of whom 322 reported using cannabis for mental health symptoms. Most, which about 71%, found cannabis somewhat or extremely helpful in managing their symptoms, and 74% viewed cannabis as a safe or very safe compared to pharmaceutical medications. The researchers also found that cannabinoids hold promise for supporting healthy aging and enhancing the quality of life in older populations, according to the research. Now, it goes on to say that survey data indicates that as many as 1 in 5 older adults consume cannabis products, with most saying that it improves their overall quality of life. That's what we need. Exactly, it's what we need. Now, this is what NORML found in their survey from this, what is happening here in Canada. And yeah, it helps with the seniors. There's no doubt about that. And I know if you look at the stats, you'll see that people 55 and older are a huge growing area of people who are turning to cannabis because, they're tired of pharmaceuticals or they've gone that route already, and just find that cannabis is healthier and a better way to go. So nothing wrong with that whatsoever. All right, from there, I'm going to move on to my next story. And this one is talking about opioid use, which is something that I've liked to talk about as I get going through the story. But here's the headline on it anyways. And that is coming to me from the Cannabis Health News. And it says, medical cannabis linked to reduction in prescription opioid use. Now, I can completely understand where that's coming from. I had my Crohn's. I was diagnosed back in 2003 with it. And during that time, in all these years, I've only had 2 prescriptions for opiates, and that was while I was hospitalized. Other than that, I haven't used any opioids out of the hospital to deal with my Crohn's in all these years. All I've been using is cannabis. Does it kill all the pain? No. Does it dull it? Yes. But all you can do is keep, try. So for some people, it doesn't work, but maybe it's because it's the strain that they've chosen. Maybe it's not. Who knows? Maybe it's the method that they're using. And as I always say, even cheeseburgers aren't for everybody, and cannabis might not be for those people as well. So here we go. Adults with chronic pain who participated in New York's medical cannabis program were significantly less likely to require prescription opioids, according to the study. Now, the study was published in JAMA Internal Medicine and led by researchers by Albert Einstein College of Medicine and Montefiore Health System. Involved 204 adults who were prescribed opioids for chronic pain and were newly certified for medical cannabis between September 2018 and 2023. Now, participants were tracked for 18 months with data on both their cannabis and opioid use collected from the New York State Prescription Monitoring Program. At the beginning of the study, most participants reported high levels of pain and were taking an average daily opioid dose equivalent to 73 milligrams of morphine. Over the 18-month follow-up period, the average daily dose fell to 57 milligrams. It's a 22% reduction. Those participants who received a 30-day supply of medical cannabis used the equivalent of 3.5 fewer milligrams of morphine per day than those who received no cannabis during the same month. Now, chronic pain and opioid addiction are two of the most pressing health challenges in the United States, says Dr. Deepak Slawik, the study's lead author and associate professor of medicine at Einstein, and an internal medicine and addiction medicine specialist. He says that our findings indicate that medical cannabis, when dispensed through a pharmacist or supervised system, can relieve chronic pain while also meaningfully reducing patients' reliance on prescription opioids. Supervised use of medical cannabis could be an important tool in combating opioid crisis. And I was going to get to North America has an opioid crisis. People are dying daily because of the opioids use. And cannabis can make a difference. It's been proven, it's been shown in many studies that cannabis can reduce opioid use, and save lives at the same time. Why don't we have more of these cannabis substitution programs that spread across North America in order to help people get away from these harmful and deadly medicines? It's just not right. Give them the choice, give them the option, allow them to use cannabis. So, all right, from that story. Now, this next story sort of blends into that story because when people are suffering from pain and other problems, they are not going to work. They're sick. They're not going to work. They're not producing anything for anybody. And how else can cannabis help with that? Here we go. This is a report that comes to me from the International Cannabis Business Conference. The headline there says reduction in German cannabis patient sick days saves billions of euros. There you go, right there. It's all right there in the headline. If you can give somebody cannabis instead of opioids, maybe some sick days will be reduced and your workplace will be more productive. So the story says, when medical cannabis policy is driven by political whims of cannabis opponents rather than science and medical professionals, it is the patients who suffer the most. Cannabis is an effective, safe medicine, and suffering patients should have significant, safe access to it if they and their doctors think that medical cannabis therapies will help. Medical cannabis opponents in Germany have continued their push to make negative changes to the nation's medical cannabis laws and regulations, and the German Association of Pharmaceutical Cannabinoid Companies is warning that if current proposals are implemented, it would create unnecessary hurdles for patients. Now, the BPC recently published data demonstrating how much Germany's current medical cannabis model has economically benefited patients by reducing the number of sick days. Report says, according to a recent projection based on a survey of 8,831 cannabis patients, medical cannabis therapy has already generated significant economic benefits in Germany, amounting to billions of euros. The surveyed patients reported that since starting their cannabis therapy, the number of their annual sick days had decreased by an average of 58%. Extrapolated, the economic benefit of this reduction in sick days for cannabis patients in Germany is estimated at more than 3.7 billion euros. Now, according to the release, they said that based on import volumes, it is estimated that there are approximately 800,000 cannabis patients in Germany. This figure is still lower than the number of people who regularly take opioids or antidepressants. Now, according to Pronova, they say that 22% of adults also take prescription sleep aids, which equates to more than 10 million people. Now, the Robert Koch Institute estimates that 53% of adults in Germany were affected by chronic illness or a long-term health problem in 2024, which reflected in sick days taken at work in Germany. Now, the report included the following findings as part of their recent announcement. The participants or the patients surveyed stated that prior to starting their cannabis therapy, they had been absent from work due to illnesses for an average of 37.6 days per year. Now, after starting cannabis therapy, these days of absence were reduced by 58% to an average of 15 days. Around 1/5 of those surveyed stated that they had been unable to work for a long time before starting cannabis therapy. For example, due to chronic pain, this improved after cannabis therapy. People are smoking cannabis. People always say they're unproductive. And there's a report here that's showing when people are smoking cannabis instead of taking painkillers, that they're just going up and they're going to work. It's always nice to see these studies that just proves all these types of myths and stories that we've heard over the years. It's just too bad that all that stuff has done a lot of damage. But hopefully, yet again, we can make a change on that. Some of these, as I mentioned earlier, some people don't find any benefit over cannabis. Well, what if maybe we can, be more specific on what we want for the cannabis? And apparently, they're saying now, there is a way to do that. So here we go. This headline comes to me from the Marijuana Moment. Marijuana breeders can use AI to design new strains, the study demonstrates. Designing new strains with AI. Now, cannabis breeders may be able to design new strains and speed up their growing cycles by utilizing artificial intelligence, according to this new study. Researchers found that by feeding genetic markers, growth measurements, environmental data, and chemical assays into AI models, breeders could stimulate thousands of potential crosses and stimulate speed breeding through machine learning before ever planting a seed. The authors argue this approach could cut traditional breeding cycles, which currently last between 6 to 8 years, down to a fraction of that time, while also improving consistency. They say this is a challenge for the commercial growers. Now, one of the biggest challenges in cannabis cultivation is the complex interaction between genetics and environment, light spectrum, humidity, nutrient availability, and subtle temperatures. Shifts can reshape a plant's chemical output. Using instruments like gas chromatography, mass spectrometers, researchers can employ AI to measure cannabinoids and terpenes across a plant's life cycle, combined with the imaging tools that assess traits such as trichome density or stress responses. These data points give AI models the raw material to make increasing accurate predictions. Report says this capability allows breeders to design strains not only for chemical profiles, but also for resilience and adaptability in diverse growing environments. Now, highlighting the importance of reproducibility, they noted that the global cannabis industry demands high-quality, reproducible strains, creating the need for precision breeding technologies that reduce time to market while maximizing yield and potency. Now, the writers caution that for all its advantages, AI enabling cannabis breeding faces challenges, including data quality constraints that affect the accuracy of genotypic and phenotypic predictions. They also note complications surrounding complex polygenetic traits, ethical considerations, and regulatory barriers, observing that legal restrictions on cannabis research may limit data or access. So there you go, AI helping you design and figure out what cannabis strains you want, and how, finding the strains that you want. Who knew? Maybe someday it'll become popular, but right now I think a lot of people are going to the tried true method and see what happens down the road. So there you go, people. That's it for today. I'm done. 5 stories. Zip, zang, boom. Got them all done. I hope you found it informative and educational. Thanks go out to you guys, everybody, for tuning in to the program, whether it's the audio podcast afterwards or right now in the live video one. Other than that, thanks to our sponsors, Limestone, City Hydroponics.ca, the Campbellford Lifestyle Shop, as well as At-Eze.ca. We'll see you at our next show, Monday morning, 10 a.m., right here at paceradio.net or 420pace.ca. And as I always say, and I've been saying this for, well, I'm going to say probably since 2008, don't forget to educate, medicate, and do not.
In the Pace Radio Network, here at paceradio.net.
The opinions of the individuals during this broadcast are their own, and may not be the opinions of their group or other organizations they may be involved with. All medical advice during our broadcast is not a medical opinion and should be checked with your medical physician.
Enjoy the buzz of legalization with Campbellford Lifestyle Shop. From lights to plant nutrients, books, consumption accessories, and more, we've got all your basics to grow or consume cannabis. Visit our info center or take a look at our piercing services and body jewelry, now available in-store through Campbellford Lifestyle Shop, 17 Bridge Street West, Campbellford.
Limestone City Hydroponics is Kingston, Ontario's hydroponics shop. Take your growing to the next level and create the optimal environment with a tent kit, or maximize your yield with an ebb and flow flood table kit. Either way, Limestone City Hydroponics has more sizes and options to fit your needs. Are you looking for the power of the sun that adapts to your budget? Then look no further, as they have professional grow lighting. They have indoor grow systems that are easy and cost effective, with many options to fit your living space and lifestyle. Cultivate your growing potential. We have everything you need to succeed. And if you can't make it to the store, they offer local delivery to the greater Kingston area. Remember, when you're looking for experts to help you grow, then look no further than the locally owned Limestone City Hydroponics, 105 Sunderland Drive in Kingston, Ontario. Call them at 613-548-0420.
We are people advocating cannabis education, here at paceradio.net.